clouds go gray. The thunder roars and the earth sings. The season's just beginning. The sunlight it hides as the clouds make way. For the pouring of my blessings, I will not be afraid. I see it now, I understand, I know. So I embrace it, dance. In the rain, it's for my seed to grow. For every prayer and every seed I've sown, the Lord of the harvest knows I'm reaping back 100-fold. The land is green, it's green, oh, oh. The land is green, it's green. Can't you see? The harvest is ready, 'cause the Lord of the harvest told me so. It's green for me. It's green for me. Standing alone can be a heavy load, but my vows I won't be breaking. Though my heart is aching, I got a word and I won't let go. It's your will I'm seeking, so I keep on believing. I see it now, I understand, I know. So I embrace it, dance. Once again it's time for me to grow. For every prayer and every tear I've sown, the Lord of the harvest knows I'm reaping joy 100-fold. The land is green, it's green, oh, oh. The land is green, it's green. Can't you see? The harvest is ready, 'cause the Lord of the harvest told me so. It's green for me. I thought it was over, thought you were done with me, but we're just beginning. Whoa, my life is a journey. I will walk with you, I will go where you.
The future belongs to those who believe in their dreams. CPI believes in their dreams, and we believe that future we will see it unfold with the work that is ongoing currently. And that work, stakeholders like you seated in this room are also a part of it now. We are hopeful that at the end of this meeting, our stories would pick up momentum, and then we'll move towards the goal that we have set to achieve. Please, another round of applause for CPI.
It is my pleasure to welcome you all to this important stakeholder and champions meeting on the Community Pharmacy Assessment and Care Progression Institute. We are present here today reflect our shared commitment to strengthen professional development, building capacity, and ensuring a structural pathway for the growth of community pharmacists in the country. Community pharmacy practice continue to play a critical role in the healthcare delivery, particularly in expanding access to medicine, pharmaceutical care, public health intervention. Therefore, establishment and strengthening of the career progression and assessment framework is essential to equip community pharmacists with the competencies, recognition, and opportunities needed to meet the evolving demands of our healthcare system. In our stakeholders meeting for PPM program we just ended yesterday, PPM is public-private mix in the management of TB program. It's a national program. And they did a research work. You know, we as a community pharmacist always say that we are the first point of contact. We say 60 to 70%. That was the research they gave, and they say 60%. It was not done by community pharmacists, it was done by federal government. And they say 60% of people seeking health always go to what? Community pharmacists first before going to what? Health institution. And we also even talk about the quality of care services. And they begin to say that even the quality of healthcare services are tending towards what? Private sector, even more than what the public sector.
So we all know that human resources for health in Nigeria are scarce. It's scarce. That is a given. Initially, it was called brain drain. We didn't even produce enough. And then even with what is being produced, there's the brain drain. And it was called brain drain before. It's now called what? Japa, isn't it? And virtually every sector, especially the health sector, has been seriously affected by these scarce resources for health. I had the Honorable Minister of Health and Social Services recently talking about the need to galvanize all the resources available. And we are saying community pharmacies are a critical part of this workforce, and we need to galvanize this potential. We have over 6,600 that were registered last year, as a community pharmacy. So there is a workforce, and it's a great potential, and it's part of the human resources for health that is available for Nigeria. But what we see is that they are not really making the best use of this great potential. And this intervention is supposed to help to actually ensure that community pharmacists can take their place and make even more impact in the healthcare sector. See what's happening in the United Kingdom. UK, let me read this quote. It says, community pharmacies in the United Kingdom have transitioned from primarily dispensing medications to serving as clinical health hubs within the primary care system. As one of the most accessible healthcare providers, with over 90% of the English population living within a 20-minute walk, they manage approximately 69 million walking consultations annually, saving the NHS roughly £38 million appointments each year. This is what data can do. This is what this workforce can do. And we can do this and even more in Nigeria. So you can see that they've been able to galvanize their the information. The information is there, and then they are not merely dispensing. They are not merely dispensing centers. They are not merely businessmen and women. These are now seen as health hubs. They have been able to contribute even to primary care, and that is where we are going. That is what we want to see in Nigeria. So then, next slide please. Yes, the career progression scheme for community pharmacists, it plays a crucial role for pharmacists in maintaining high standards of professionalism, competence, and patient care. So if we're talking about the workforce, we want a workforce that is competent, that can add value. And that's what this scheme is supposed to do. It ensures that pharmacists are well educated. Of course we're educated, but we don't end that there. Education is continuous. We want to acknowledge this year. We started with the MCPD, but we are taking it even further. This is now like practical, practice-based improvements, professional development. So we are trying to ensure that pharmacists are well educated, up to date. Because you can be well educated 40 years ago, but you are not relevant anymore. Up to date with current practice and dedicated to providing safe and effective pharmaceutical care. Now, by establishing standardized criteria and evaluation procedures, and that is critical. This is not something that you just say because I've been practicing for so many years, I'm automatically qualified. No, we are looking at standardized criteria, and Prof will speak more to that as we go on.
Two key challenges stand out in community pharmacy practice, and research has shown this. The first is that there was no structured way for remuneration of community pharmacists in Nigeria. And our 2013 study that was conducted by my team, published as the Pharmacy Practice Journal, showed that clinical pharmacy practice continues to be the most preferred destination for graduating students. But it will shock you to know that the attrition rate of community pharmacists or pharmacists in community practice is very high. In fact, in our 2022 study for the intention to quit the profession, community pharmacists ranked the highest that we are willing to quit within 1 year. And I think that this move by CPA-CPI becomes very, very evident for us to follow. And what did we do? We set up a Delphi team, a team of collaborators drawn from all aspects of the profession. And that also did what? It allowed us to generate a template that will see progression of pharmacists all through 5 bands. And these 5 bands, we try to do with a lot of thinking. Series of Delphi meetings were held, team meetings, over 7 rounds. And a very robust template was produced. And that robust template is what I'm going to be talking to you about today. And also we want to see that these indicators are objective enough. So let me walk you through the templates, which shows also the ranks of community pharmacists as they move through the institute. Quite simply, 5 ranks. Community pharmacy rank, the senior community pharmacy rank, the specialist rank, the senior specialist rank, and also the one that is the big elephant in the room, the consultant rank. For want of time, I will just take the first, the third, and the fifth, but they are all progressing, all in unison. But before I do that, what exactly were the criteria we developed as a team? Years of practice, very important. You can never take experience out of the room. The years of practice was used as a criteria to continue to put pharmacists along that ranking system. Then we also have the criteria for advanced qualification. That's where WAPCP comes in play, because we are collaborating very closely with them. I will take you through these ranks. You'll find out at some point, for a particular rank, you only just need to have enrolled for part 1. But of course, you know, for the big fish in the room, that's the consultant. You should have finished and completed your part 2. Also, the normal university degrees, your masters and your PhD is also one of the qualifications you need. And also, specialized training certification is also part of the advanced training. Research productivity, we talk about the 7+1 pharmacists, and one of these is the pharmacist should be a researcher. Let's not forget. This was one of those criteria that had a lot of arguments. People were like, community pharmacists be researchers. What we did was we toned the quality, not the quality, sorry, the quantity of research you should do. And those of us who are well-traveled should know that community pharmacists all over the world are heavily involved in research. You're sitting on enormous data. In fact, some of us are not even willing, even when academia wants to come and get that data, some of us are not willing. We think that this could be one of those areas where we could rejig community pharmacists to start getting interested in community practice. Late Professor Dara had a publication on that shows low levels of interest in research as regards community pharmacy space. The community pharmacy practice is a setting for training. Training not just for students, but also for local and also intending pharmacists, or young pharmacists that are great. That is also a criteria we are also going to assess along the chain. Of course, PCM comes into play, license. The PCM license, your annual registration license is a criteria. Your PSN registration for the year capitation is a criteria. And the ACPN registration for the year accreditation. These are what called prerequisite criteria. They are not even scored. You should have them. It's either a nil, it's a yes or no answer. You don't score. You score maximum if it's yes. You score 0 if it's no. So it's a prerequisite.
For the CPSPI, one of the core components for the program is not just looking at the pharmacist, assessing the pharmacist as an individual, but we're also looking at assessing the premise in which the pharmacist practices. Because we feel that you cannot isolate the actual practice from the person. So one of the areas that we've collaborated within the CPSPI is to actually look at a marriage between COPA, which is an indigenous standards developed by the ACPN with technical support from Harvard University initiative. And we're looking at not just COPA standards, but we're also looking at safe care. Safe care are international standards accredited by the International Society for Quality in Healthcare. And so we're looking at a situation where we're going to integrate our indigenous standards, COPA, with safe care. And in doing that, we will award quality levels from level 1 to 5, or level 1 to 3, depending on which framework. So why does quality matter in the community pharmacy? A lot of patients actually go to the community pharmacy. I mean, it's the first primary point of contact for many Nigerians. And so we want to be sure that the services that we provide are safe and are of high quality. And so patient safety is very important. And we have a huge impact on public health, because within the pharmacy we not only provide services, but we do a lot of counseling, and we also refer patients to the next level of care. And then within the pharmacy we're expected to be compliant to regulatory standards. So the standards that PCN has set, the standards that NAFDAC has set, we're expected to comply with these standards. And we are also seen as professionals. So we're respected members of the society. So when people come into the pharmacy, they're coming to us as persons of influence, people who can actually tell them how to manage their problems or healthcare problems. So in looking at quality assurance and quality improvement, CPA-CPI is really focused on pharmacists improving the quality of services that they provide. The PCN has set the minimum standards, and the PCN always will come to your premise to come and inspect your facility and see whether you are complying with the minimum standards of care. So in CPA-CPI, we see quality assurance as the minimum or the minimum standard, meeting the minimum standard. But we're looking at quality improvement as getting to the ceiling, where we want you to move from the minimum to the optimal standard. And so QA and QI are actually complementary. So QA sets like the foundation, whilst QI raises the ceiling. And everything that we do in terms of quality improvement is based on the Donapedian framework, which looks at the structure, the process, and the outcome. So when we look at the structure, we're looking at your premise, the equipment that you have, your storage facilities, your SOPs, the layout of your facility, and how compliant you are with PCN's premises standards. And then when it comes to processes, we're looking at your dispensing practices, your counseling, your verification, the fact that there's audio-visual privacy, especially during the time when you are counseling patients. And we also want to assess your referral pathways, because we are the best way to ensure that you are providing the right services, to be able to identify people or other healthcare providers within your environment that you can collaborate with. Because we want a situation whereby the patient gets the best care in your facility and also gets referred to the best services that are available within your community.
Opportunities for strengthening primary healthcare. And this is where I want to give some critical examples of how we can all collaborate. Please, what I'm going to talk about is not exhaustive. And this is where I need you to listen actively, because after this presentation, you will be expected to make some feedback. You would also be expected to fill a form. We need you to tell us other areas that we can all collaborate together to achieve our common goal. Okay, so I'm just going to give a couple of examples. We talked about the health priorities. So let's go along the lines of the health priorities. How can we collaborate along the lines of the health priorities to be able to achieve them as far as the contribution of community pharmacy practice in Nigeria is concerned? So preventive services. So under preventive services, we can collaborate, and this is what CPA-CPI is really about. It's really about strengthening community pharmacists to be able to provide key preventive services like screening, and improve and update their knowledge and practice and specialize in a lot of these areas. And so therefore we can collaborate along these lines, screening from common illnesses, hypertension, diabetes, and so on, communicable disease control. We just talked about malaria, and we have one of the buzzwords now, HIV self-testing, for instance, and then non-communicable diseases. We need to be able to collaborate and see how community pharmacies can be seen to be contributing to each of these indices as far as the national health priorities are concerned. And it will take everybody here to articulate where they can come in and work with CPA-CPI so that we can push this agenda forward. So maternal and child health is another buzzword currently, and there's a lot community pharmacies can do there: iron folate counseling, family planning, and ORS and so on, geriatric care. This is not so popular, but these are all areas that we can get involved in and make very relevant and useful contributions to our national health outcomes. So you have areas like polypharmacy reviews and fall risk medication assessment and all of that. Data sharing and surveillance are very important. One of the things that that I had mentioned earlier, and I want to tie a lot of what I've been saying down here. The fact that even as it is right now, community pharmacies are rendering so much services, but the visibility of those services is almost nil. Again, it wouldn't be enough that we support community pharmacies to even enhance both the access to these services, the achievements, you know, the quality and all of that, but we must also find a way to get data from community pharmacy coming out and being integrated into the national database. That's very key. Now, somebody here should be thinking, how can I support, how can I collaborate, how can I fund, how can I make sure that this happens, you know? And we're really looking out for participation in this endeavor. Let's see how, beyond that, you know, we just said that community pharmacies, that's one of the first places that a healthcare center will go to. So it actually places probably the community pharmacy as the best place for early warning indicators.
Sometimes 2 weeks ago, I got an email from the DRPC that you need to go and support us. Your professional, your persons are asking for support. And because I'm a pharmacist, they thought I would be the best person, and that is how I found myself here. So now, what are they pledging? They said I should tell you they are willing to support this process, but I'll put a caveat within the limits of available resources. So in practical terms, what I would like to plead or pledge and advise is that when we are done, I'll write a short reflection report, but I'll also plead that you write the report highlighting the areas. I've listened to the last presentation where the development partners were charged with certain responsibilities. And we have some 12 to 13 tasks. So you should add that. But remember that I know you're already doing this very well. The asks may not always be in form of money or finance. They might be in kind. I remember you said some people supported the development of the website and what have you. So keep it that way.
On behalf of the management of Society for Family Health, we feel strongly elated to be associated with this initiative. Over the last 40 years, SFH has been a partner of PSN, ACPN in improving access to universal healthcare. Over this period, we've worked with ACPN, PCN to expand access to healthcare, and also to strengthen regulation. For this initiative, because I have 2 minutes, we're already working with ACPN on several fronts. We conduct trainings for pharmacists in some of our states. We have worked with the federal ministry to expand reform policies that provide more space for CPs to operate. But beyond that, I think we're happy to work with the Institute in several fronts. First, we'll work with you in the area of training and capacity building. Just to also state that even before now, we've worked with the PCN to develop an e-learning platform specifically for CPs.
See how we are focusing on pharmaceutical care, the impact and all of that. It's very important. And that is where we come in. We want the community pharmacy, as important as they are in the society, to focus on that part. Why we? Because we know the goal of every business is to make money. Registration, money to fund this, to do all of that. So every community pharmacy is looking at making profit, making money. And that's where we come in. Focus on the pharmaceutical care. Let's help you sort your financing part. Collection of funds. Let there be no robbery, no theft. Somebody come and buy 40,000 products, but your salesperson made a mistake and press 24,000. That person is gone. But we have a product design that immediately the person is buying from your system. You just see on the POS 240. There's no need for you to press. So we are ready to help you with collection of funds. We are ready to help you with financing. You want to expand, you want to grow. Yes, time will take good rate. our rate is very good. And that's where we are. As a pharmacist, I fought for it. My line manager is also a pharmacist. And we have made it known that community practice is a key account. It's not just a roadside business. So every attention that is needed for key account is what we are going to give to it. The POS terminal we are going to give to community pharmacy is free. It comes with data, so you don't need to bother, and it comes with paper to print receipt. That is the solution we are providing.
When the idea of CSCPI came in, we embraced it completely. Shell, Dr. Sieva used to work for Howard University, and when she called me, I said, of course, that's the next step. We have started the COPA program working with ACPM, and several people got involved from universities got involved with that COPA program. Actually, COPA was an idea that was, I think, brought in during Tony Ayibe's time, but the funds to get it actualized wasn't there. Well, the SFI program that we were running what an opportunity to be able to actualize that program. For me, this was a natural progression from working with pharmacists to go on with working with pharmacists and giving the pharmacists some level of fulfillment in the profession and in their practice. And beyond the level of self-fulfillment, also giving the public a better awareness of what the pharmacy practice can be. You have situations where things are happening and it looks as if pharmacy is a profession that is disappearing gradually. But with this kind of intervention, the next 10 years, 15, 20 years, it's not going to be an immediate thing. Hopefully the public, the government will be able to appreciate the contribution of the pharmacist, particularly the community pharmacist that is the first point of call for most people in our country.
JAPIGO is a non-governmental international organization. We are an affiliate of Johns Hopkins University. And in Nigeria, we have been in existence for over 50 years, where our core interventions is on maternal newborn health, global health security, HIV, and others. In JAPIGO, our interventions and donors, as we are the pride of our donors because of our integrity and the quality of interventions and that we conduct in Nigeria. As per the ICPA, you were in our office some time ago, and the country director said I should reiterate that we have a number of state offices in Nigeria, and that you are welcome to leverage on those spaces. Feel free, get in touch with us, and we are willing to support you with that.
And just to mention that I support the government of Nigeria in improving health systems, ensuring that health is accessible to the population. More like business solutions for public health problems, supporting the government to ensure that we save lives and provide support in different areas. I'm going to talk about 3 key opportunities that might be available that we might want to explore. For child, I think our strengths, we can talk about public health programs, vaccines campaigns, health screenings for non-communicable diseases. Those are things that we work on. Talking about the medication and management and access to essential medicine on reserved areas as well. And also there are also opportunities in disease-specific programs, maternal and child health, non-communicable diseases, and all of that. Just to mention specifically, right now the malaria program is working with, collaborating with the community pharmacists in Kaduna and Katsina states to improve testing behavior with respect to malaria.
Looking at the presentations from Dr. Afata, it was a very interesting presentation, and we have been having this kind of conversations, especially considering that HA Clinics is a primary healthcare that is indeed focused on preventative healthcare, right? Of course, in our space, we have clinical pharmacists. And within the sphere of EHE clinics as well, the EO Africa Foundation has a lot of projects and partnerships that they do. Talking about eradication of polio, then talking about monitoring and controlling and implementation of a lot of programs. Unfortunately, I can't mention one specific right now. However, there is also one of the greatest things that they do is, GIS marking, which I think one of the things that they are known for. So for us, I think looking at development of monitoring and evaluation of systems of community pharmacy in Africa, something that in Nigeria, something that fits into the data repository is an area that we are looking to contribute to, considering that we do have a lot of experience in that regard. Then, quality improvement programs. So, EHF Clinics is a JCI accredited organization. This means a Joint Commission International organization that is particularly geared towards quality and safety in healthcare. So I led the pharmacy team to receive this accreditation on behalf of the clinic. So we are actually very, very experienced with improving quality and safety, things like reducing medication errors, championing antimicrobial stewardship programs. Those are the things that are at the core of our values we present. So we will also be able to partner in that regard as well.
When it comes to project implementation with community pharmacists, I can say we're already doing that, and that's something I think and I know we would want to partner with this body. I think recently we just concluded a project that was funded by Gavi. It is called the HPV vaccine project. And one thing that we did that was outstanding was we got most of our partners in Adamawa State, Abuja, and also in Nasarawa to be part of the program. So what we did was we used community pharmacists to engage caregivers, and it was a resounding success. As against, because there were other partners that, of course, they went to primary healthcare centers to see how they can use the PHCs to also increase the number of the girl child that were vaccinated, because the program was targeted at girls between the age of 9 to 14. But for us as an organization, we decided to use our community partners, and the number of engagement we got was very outstanding. And I stand here to say that the people that funded the program, which is Gavi, they've said that they'll come back because of the impact the community pharmacists, because of the level of impact we're able to record. So in that regard, I know we will do that.
I represent the Nigerian Consumer Credit Corporation. I've been in the banking system for a while before joining this new organization that the president set up about 2 years ago. And the essence of the creation of the credit corporation is to make credit accessible to an average Nigerian. Currently in the country, we have 3.5% of the working population having access to credit. And I'm sure you all know why. The banks have the money, but the credit infrastructure for the country is not robust enough. When people take the loans, they don't pay back, and there's no penalty. So we were set up for three purposes. Number one, to make capital available. Number two, to look at portfolios that are delinquent and see if those portfolios can be guaranteed so that the lenders can lend more. And then to create awareness why credit is not a bad thing. The Onibese syndrome loan, I will explain quickly. If you take loan, responsible loan is what we preach. If you take loan and you use it responsibly well, it makes life easier.
So please do appreciate pharmacists. And several acknowledgements. We have defined pharmacists as professionals who are most of the time the first point of contact for healthcare. We WHO has also acknowledged the role of pharmacists in primary health care. We have supported organizations like the FIP, the American Health System Society for Pharmacists, to define guidelines. And as a result of that, we do acknowledge that career progression is necessary to motivate health workforce. And that is one of the things that leads to international migration of health workforce. People looking for greener pastures may not just be because of the money, might be because of the satisfaction of the job, because you have to see yourself as progressing. After 10 years as a community pharmacist, incidentally I started from community pharmacy, and I wonder if I have been there till now, I'm still registering for somebody. What level do you want to be in? Because come with the years of work comes with experience, and experiences should be rewarded. So I give this background to just acknowledge and to say we share in this spirit, in this work. We acknowledge that things have to be done, and to pledge that from my own end, we will be able to make technical support provision into the work.
You know, it gives pleasure to a father to see that his child is doing well. And when you have many children, and the first child is wayward, you will not be happy because it infects the others. But when he's doing well, you know that the rest will do well. Either you are doing well, so I think that you do well. So I'm happy and glad to see that we are just not doing the daily activities of technical groups. We've gone into intellectual activities that will add value to pharmacists. That's what impresses me. And when I was project director for PSM ACFA, we engaged ACPN in so many activities, and they did well. They always turned out well. So the government has a ready pool of experts in healthcare in case they want to do anything. For example, now we are now advocating, and I think that we accepted, that community pharmacists should be used for immunization, should be used for other interventions that don't require clinical in-depth. So they are the most ubiquitous class of healthcare professionals, and they are always ready to help. So I think your importance in the healthcare sector cannot be overemphasized. So we at PSN, we like what you are doing, we will encourage you, and in case you need the weight of PSN to do anything, let us know. We shall back. So on this note, I congratulate you for this session and hope and pray that you move ACPN and by extension PSN to greater heights. Thank you very much.
In recent times, we find that what is happening in the wider society is also happening in the professional group. It should not be so. We were all trained as pharmacists, and as I was growing up in pharmacy, discipline was a catchword, to the extent that if one person is a year ahead of you, you respect that person until death do you part. Discipline. So, but today things have changed so much, and I think I'm going to use this opportunity that the #1 pharmacist in the country is here to maybe I'll visit his room and we shall talk. What is going on here today is beautiful. What has made it even more beautiful is that the people we have put in the board that are pushing it are the right people to do it. Well trained, well groomed,
and they are coming from a point where they are not reading the notes that our forefathers used to pharmacy. They are current. They are very current. And that is where people like me come in. If you watch very well the conference in Kano, if you listen to the keynote address, that was one of my greatest keynote addresses I have listened to in recent times. That professor, madam, from UI was fantastic. She was talking of the new pharmacy. Everything I listen to these people today, I feel very, very fulfilled that if we follow it, we are going to arrive there. Now, why we are different, these past presidents are different from all of you, is that it's not only that we are intellectual, but we are political. Every one of us has been fighting a battle of emancipation of pharmacy since from, that's all we do. We are going to look at everything that is going on. I don't want to let out our own experiences, which I'm going to share with you people, to ensure that this succeeds. We need to support this initiative. We need to support with all that we have. Every pharmacist. And the word that comes to me is, can we make it mandatory? Because I saw 50 for 1 year. Where are the advocacy? Have you gone into the pharmacy schools to preach this? Have you gone to the schools to preach this? Why not? Because we should make it mandatory that every young pharmacist who goes into the community pharmacy, that platform, that system, must register. I have a lot of suggestions to make, and I think I will get back to you. But one important one is that I think that the board, your board, should include an employer of pharmacists. Somebody who employs pharmacists. Because like I was sharing with Dr. Waga, I said, okay, what if you tick all the boxes? And the institute gives you the pass mark, 80-90% for the consultant. And you get back to your chairman CEO, and he says, look, you've not been to work in 1 week. Or you come 2 or 3 times a week. I'm not going to pay, I'm not going to promote you. So we need input of employers in the board. Noted? Yeah. So that's the point I'm making, that they are input too, possibly they are inputs. And not as a group, but you can look at some successful. There are many of them here. And then get their buy-in into this. But for the PSN, ACPN and other groupings, this is something if we work well with, it will change what we are in pharmacy. We are celebrating this concept only because of one reason. Because we chose continuity in ACPN. Ordinarily, the first thing you observe with leadership in Black Africa, especially Nigeria, are policy somersaults. So if we did not have the carryover of the tendencies of the Wale Oladipo in Ambrose says, these would have been in the dustbin of the street. And that's the truth. And that is one of the reasons people like us are sometimes branded as members of a non-existent cabal. But I think you see the benefits. I believe you see the benefits in this. So, I think the ACPN is on the right track. I have reviewed everything you've done under the ambit of CPI, even before today. And I want to thank the chairman of the board, the members of the steering committee for doing a very good job. I remember my critique in Oka, and I want to thank you for seeing it as a positive contribution to us, not that of an alcohol. Thank you.
would like to say that, of course, the Pharmacist Council of Nigeria remains an agency of government, and we work very, very closely to achieve the objectives of government policies that set out by the Federal Ministry of Health. The PCN remains a formidable partner and a strong force in shaping the pharmaceutical sector in Nigeria, and we will continue to support them. I want to just point out that it is our very honest observation that in this kind of venture we do very well to involve the Federal Ministry of Health more than we have done. The Director of Food and Drug Services Department clearly is of the opinion that we were not adequately carried along in this endeavor, and it will be good that going forward we are carried along just so that the government is in this journey, just so that the government supports this journey, just so that the government helps in nurturing this noble idea and objective.
What we're doing here today is exactly what the board stands for. Helping mentor young ones and new professionals what it should be for tomorrow. As a champion, for what I've seen, we are the employers of pharmacists. And indeed, this program, we are the best beneficiaries if it works out and we're able to work out properly. With the board we have and what we've done so far. Because as you grow in guts, in strength, and as you grow in weakness, as you're growing older, you need your best to continue to prosper, to grow. That means the products of this institute will be the backbone for our tomorrow as we go to retirement. So having pharmacists who have been groomed through this program, we can go home on early retirement and enjoy the fruits of our labor. So thank you, SCBN. Thank you to the board. The third one, I'm sure I didn't have how much support. The fact remains that we are in the time in the country today. We are all corporate organizations, and for corporate governance, we believe that we are no more making comments publicly, because this mic can get to anywhere. With the new tax laws and all the restrictions, even spending your money, you become a victim tomorrow of official bureaucracy. So nowadays, corporate bodies don't want to speak about funding, about costs publicly. That's why we set up foundations and holdings, so from the back, they can justify the expenditure they make during the public. And in line with corporate governance, Pharmacist Pharmacy and myself will surely support this program. As we said earlier, it's like crowdfunding. All of us in this house, the champions we've made, will consider this program from the people I see here. And I've always said something, think globally and act locally. I want this message sent to every nook and cranny of pharmacy pharmacy. Beyond this event in Abuja today, the state chairmen are here. Let them get pharmacists in their various localities to understand this program.
The PSL Foundation is so excited that this is happening, and that because in the policy, advocacy, and creating a enabling environment space where the PSL Foundation works, we've had lots of knocks from other participants and there is a stakeholders in the healthcare sector. And most times it's like, oh, what are your symptoms doing? We can't get data from them. We can't see them for meetings. We call them for trainings, they are not there. And a lot. But I think this is something that is now going to gingerly and change the narrative. The work PSM Foundation had done in recent years, let me say the last 6 years since I've been leading, has literally been so much beneficial, 80-90% to community pharmacists. I'm a product of public sector, but I just found myself there because of my public health background. And I want to say that kudos to those who initiated the PSM Foundation, brought it to life, and the past project managers and directors of the PSM Foundation.
Thank you so much for your feedback. It's been so useful. I just want to say that our champions, as you are being decorated, we are actually counting on you to be champions indeed. Champions in terms of guidance, champions in terms of advice, champions in terms of support. Thank you, Federal Ministry of Health. We would, just like she said, we're still co-creating, so we'll still work with you very closely. So each and every one of you is very important here. And one of the things you do for us is to make sure all your staff, your pharmacists, are actually enrolled in this scheme. But beyond that, even as the IPC said, please, the mic will be available. If you want to commit yourself to something, please, it's very much welcome.
Bring it on, bring it on. You, bring it on.
Life know the sweet though, hey. If some people know they hate you, so use the number 6 so and calculate. You go see the ratio. The beef self na me go, whether na asu them relate to. So bring your own crayfish, oh, we go mix, oh, oh Lord. Shane and them talk say, we no go blow. Share them they see us now, we don't they glow. Take a look at me now, take a look at me now. We're running things in this town. Can't you see?
I don't care who you are, where you're from, or what you do. Just as long as you're chasing money, do what's right, never give up on it. Bring it on, bring it on.
Are you ready? Wanna ready?
No matter how you try, don't you ever fall. Keep your head up high and standing tall.
Bring it on, bring it on. Are you ready? Wanna ready?
No matter how you try, don't you ever fall. Keep your head up high and standing tall.
And rising, rising, rising. Keep it high and rising, rising.
Bring it on.
This life is not easy. So much hustling and puzzling. Everyone is struggling. So make you know they believe, say, since everyone is chasing, you're never gonna make it. Never say no, never give up. Keep your head up, standing tall. And for sure, you go turn it up, turn down for what? Hey, Shane and them talk say, we no go blow. Share them they see us now, we don't they glow. Take a look at me now, take a look at me now. We're running things in this town. Can't you see?
I don't care who you are, where you're from, or what you do. Just as long as you're chasing money, do what's right, never give up on it.
Bring it on, bring it on. Are you ready? Wanna ready?
No matter how you try, don't you ever fall. Keep your head up high and standing tall.
Bring it on, bring it on. Are you ready? Wanna ready?
No matter how you try, don't you ever fall. Keep your head up high and standing tall.
And rising, rising, rising. Keep it high and rising, rising.
I don't care who you are, where you're from, or what you do. Just as long as you're chasing money, do what's right, never give up on it.
Bring it on, bring it on. Are you ready? Wanna ready?
No matter how you try, don't you ever fall. Keep your head up high and standing tall.
Bring it on, bring it on. Are you ready? Wanna ready?
No matter how you try, don't you ever never fall. Keep your head up high and standing tall.
And rising, rising, rising. Keep it high, rising, rising.
Irony of life.
Beautiful, beautiful,
beautiful,
beautiful,
so beautiful.
Beautiful,
so beautiful.
life is so beautiful. This is meant to about.
Yes.
Okay.
Yes.
The world is beautiful. I'm a perfect example. Everything is on you. Life is so beautiful. Beautiful, 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 beautiful. Life is so beautiful. Beautiful, 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 beautiful. Life is so beautiful.
So beautiful.
Now I'm so joyful because my life is so incredible. Everything around me is so peaceful. Hard times will come but I will stay hopeful. Those days I was never thoughtful. The mistakes I made are my breakthrough. Now I realize the world is so beautiful, so wonderful, so peaceful. Never knew it got things could be so helpful. I learned the hard way, the only way. Now I'm a big artist for Nigeria. Fifth album is on the way. Yeah, yeah. I'm so happy. What is so beautiful for me? The world is beautiful. I'm a perfect example. Everything is on you. Life is so beautiful. Beautiful, 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 beautiful. Life is so beautiful. Beautiful, 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 beautiful. Life is so beautiful.
That's why I say the seas, the stars, the sun, the moon, the moving, reading with you. That's why I'm grateful for all the beautiful things that I see. Your love water, cause water no get any, but water can scatter the whole city. That's why life is beautiful. Cause if there's no dance, then you will not respect life. And love beautiful fire. Fire can cook for you, but fire can destroy everything that you build. At the same time, the most beautiful woman can be the devil, but the most ugly woman will be the most beautiful.
The world is beautiful.
Irony of life.
I'm a perfect example. Everything is on you. Life is so beautiful. Beautiful, 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 beautiful. Life is so beautiful. Beautiful, 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 beautiful. Life is so beautiful. Nigerians, we are all out. Whatever we do, we sold out. Now the rest of the world is on the lookout. Yes, we better watch out. We are unique, we are wonderful. We are superb, we are simple. No matter what, struggle continue. You know they give up, we are disciples. We live in Bible, no matter what happen. No they grumble, we believe in miracle. Baba Ashe, Ayoju. Because life is beautiful. I know